Hey, we are live. We're talking about functional neurologic disorders and flare-ups. I got so many great questions that I'm really excited to talk about. Everything from do you have flare-ups? We're going live with Kamila Tan today, and we're going to ask her this question. We're going to talk about her experience with flare-ups, and I'm so excited to bring her on. Okay, there you are, Kamila. And as I bring Kamila on, I will just introduce myself. My name is Julie Hirschberg. I am a neurologic physical therapist and the owner and founder of Re+active Therapy and Wellness, where we have an FND program. And I'm actually just so stoked that you in here, Kamila. Kamila is a mental health professional, a professional volleyball player. She's part of our team. She's in my office right now.
Yeah, I am.
Yes. So I'm at home, you're in my office.
Yes.
This is so fun. So the theme is something that everybody voted on, and I know it's a really common theme, which is about flares in FND. And you know what, Kamila, I should first say, and I'll monitor, I see some comments already coming in, but we should have you share a little bit of your story first, and even your experience with flares, because I'm not sure everybody knows you and your story.
Yeah, I always forget I should reintroduce myself again. Yeah, but hi, I'm Kamila. As Julie mentioned, I am part of the reactive team here, so I'm on the psychology team. I'm a therapist on staff, and I love it. I love getting to have, I love being blessed to be able to help people navigate this very like complex and challenging array of symptoms, and also very treatable if done well. So super excited to be part of the staff here and also have lived experience with FND and be able to speak on that as well. So my a little bit about my story. As you said, I'm a professional athlete, so I play professional beach volleyball on the domestic and international pro tours, which is so much fun. And before I actually went pro, I had about a 2 year period with FND. And like for those 2 years, for the majority of those 2 years, I didn't know what it was. And then once I figured out what it was, I had a relatively fast recovery because I was able to identify nervous system regulation techniques that worked really well for me, and didn't fear my symptoms anymore. So I feel really grateful to be able to play again and experience my life again with so much joy and expansiveness and not be afraid of symptoms if they do present. Um, a little bit more background. I've recovered from an eating disorder in the past, which inspired my choice to become a therapist. So I have a lot of experience in that realm as well. And yeah, that's me. I also have two cats.
They're the cutest. They are the cutest.
Uh,
Camila, people submitted questions, and one of them literally was, "Do you have flare-ups?" And so I wonder if you can talk about that. What does that mean for you? Um, and also maybe a little bit about like what were your symptoms and kind of where you are now too.
yes. I like to say I had around like 30 different symptoms because for anybody that knows how FND works, the brain can literally create almost any symptom under the sun, in order for the nervous system to grab your attention. So my symptoms were like up and down all over the place, fluctuating, but I had weakness, I had like paralysis type symptoms where my leg would drag on the floor, I had numbness and tingling, I had like brain zaps, I had like this squeezing pressure at the back of my head, and I had a ton of tremors and shakes. I didn't ever lose consciousness, thankfully. But I had a lot of seizure-like symptoms in which my whole body was shaking and tremoring for long periods of time. I there was periods of time where I couldn't do any physical activity, and I was terrified to do any physical activity. I had brain fog. I had like my speech would slur sometimes. Uh, I was afraid to drive at one point because like the whole left side of my body was numb. I thought I was having a stroke. So yeah, those are just a few of the ones I can remember off the top of my head, and there were more, but the ones that were the most terrifying to me was the tremors.
Mm.
Some of which were very apparent, and some of which just felt like a excuse me, like a almost like an internal buzzing underneath my skin. It was almost like
Mm.
I was constantly tremoring underneath my skin and it was just about to like burst out of my system.
Mm. I feel like I hear that description so often, Camila. Like
Yeah.
to know that you've experienced that, it just brings like so much empathy to what you do with clients as well. Now, how about flares? Have you experienced flares? Somebody also even just wanted to know, what do other people experience with flares?
Yeah.
And I just see some comments in here as well. Somebody said, I feel that all the time too. And somebody asked too, did you have fatigue alongside your other symptoms?
Yes. Yes, I had fatigue all the time, and actually one of the excuse me one second. Sometimes when I talk a lot, I just get like something caught in my throat. Um Maybe it's an FND symptom, I don't know. um but yes, I had like chronic fatigue. Um, I also had like really bad insomnia.
Mm,
One of my FND symptoms was terrible insomnia because I was tremoring in my sleep, so I was constantly like
mm,
waking up in the middle of the night, and also falling asleep was really really difficult for me.
mm.
So yes, I had both of those things. Yeah.
Yeah. Yeah.
Um, Go ahead.
Well, and then like I know I got distracted by people's comments. So flare, like what have flares maybe looked like for you?
Sorry, I'm just trying to get this thing out of my throat. Um, Flares, yeah, so flares, I'm really glad that this is the topic that came up because um, I had a really bad flare this past week in which I got like a stomach virus. I got like a stomach flu or food poisoning, and I was throwing up during the day, during like for almost a full day. And I felt horrible. I had body aches, I had all the flu like symptoms. And then I was tremoring all over again, and I had to like wrap myself up in blankies and put a heating pad on my stomach and try to take tiny sips of water. And I knew I was in an FND flare, and I also knew it was going to pass, right? So because it was a neural pathway that was already established in my brain previously, it I I knew that it was possible that this could happen, and I also wasn't afraid that I would get stuck there. So I did all my self-soothing techniques, including like taking a hot shower, using the heating pad, putting ice on my neck and on my forehead. And you kindly reminded me to drink electrolytes that day, which really helped, right? I needed those electrolytes in my system for proper nerve conduction and just replenishing the salts and things that I had lost from the sickness. And by, a few hours later, I wasn't tremoring anymore. So it passed. But
Yeah.
that was like one of the bigger flares that I've had for a long time. So yes, I do still get them, and usually they only last like a few seconds or a minute, right? Like symptoms just come and go quickly, and I always see them as information, right? But that's because I've practiced regulating my nervous system so well, and I know what works for me in terms of regulation. So the symptoms don't need to stick around to alert me to anything. Like it's this self trust that I have. Yeah.
Yeah. Yeah. And you had a big word in there of just like, I knew what was happening and I didn't fear it,
Yeah.
right? You didn't think, oh no, I'm stuck here where I was a few years ago and I'm never going to get out, right? Which I think it's kind of normal to feel that way, right? Like, oh my gosh, I'm stuck. I'm not going to get out. And I'm really curious, but we also know that that can keep you stuck and make things worse because it dysregulates your nervous system. And so as people are sharing in the comments, it's hard to get unstuck. It's frustrating. I don't know what to do when it's happening.
Right.
Um, Lizzie is sharing here. It's they're experiencing weakness in their arms and legs and couldn't get them to move, even though I wanted them to move, and
Right.
and just getting stuck and stuck and stuck. This is really, really common. What I think you mentioned some things already, but what can you recommend for people who are feeling stuck or fearful?
Yeah, it's a great question. I want to bring so much loving connection to the people that are engaging with the live and maybe experiencing a flare at this moment, because it is a really terrible place to be. And I mean, there's so much uncertainty and fear around, am I going to get stuck here forever? What do I do to get out of this? And especially if you're alone, it's really hard. Right. So I wanted to bring like a moment of connection to that. What I would recommend, so one of the things that I love to discuss with clients here at Reactive is the symptom fear cycle, right? Which is what gets you stuck in a symptom flare, right? A symptom happens, and the way that you respond to it makes the symptom continue or stops the cycle. So you always have a choice point, right? Like our first reaction to a symptom is usually automatic, right? Usually a symptom comes up and we're like, "Oh my god, what was that?" Like, "Oh no, I don't want that symptom." It's fear or it's frustration or it's anxiety or it's sadness, or it's annoyance, right? We could just be annoyed that it's present. But then we always have a choice of what our second reaction is and what our third reaction is. And so we have a choice to break that cycle, right? If we go symptom and then we get afraid of it, then the symptom perpetuates and we stay afraid of it and the symptom perpetuates. We get annoyed and we get angry and the symptom perpetuates because we're just upregulating our nervous system with that cycle. But how we break it is we have a symptom, we have that initial response, and then we say, okay, now I have a choice, right? I could be bored of it. I could laugh at it because it's predictable and like it's kind of funny that it's here right now. I can soothe myself, right? I can say thank you for being here and giving me some information that I need to take care of myself a little bit better in this moment. I can distract myself, but like mostly what works best for me is humor, boredom, or soothing, right?
Mm.
And usually it's soothing. Soothing is what I go to like almost immediately because I'm like, oh, like I clearly I'm stressed. I just need a hug.
Mm.
So that's what I often recommend to my patients, my clients to break that cycle, and that's how you get unstuck. The way that you respond to your symptom determines how much it perpetuates, right?
Yeah, yeah. And gosh, I thought that was like really beautiful how you shared that. And I feel like as I was thinking about that, I was like, this extends beyond FND, right? Like this is injuries and pain and so many other things. Anticipating hard conversations. I mean, there's just so many. I was like, oh my gosh, I'm going to bring this to like my entire life. Um, but that pause, right? And this is a bit of a mindfulness practice, is taking a pause to kind of get curious before getting stuck into the cycle. And it's just so hard, right?
Right.
We get programmed, and our brain actually creates some of these predictions. I know we talk about the predictive brain a lot, but the brain actually predicts for a symptom to occur. And we do know in FND that that predictive brain pathway is like stronger, and it's holding on for dear life. So we end up almost having to, potentially work a little harder to pause that prediction and update that prediction with new information.
Totally. I love that you brought that up because it is a practice, right? It's not like the first time that you try to stop the cycle that it automatically stops. Right. It is like a practice to kind of undo that wiring in which that cycle has been cycling for however many weeks or months or years that it's been going on. And so it takes practice to kind of like stop, okay, it's still going, but I'm still gonna choose to respond differently. And okay, it's still going, but I'm still gonna choose to respond differently. And eventually your brain will trust you that it doesn't need that symptom anymore, but we can't control exactly when that's going to happen, right? We just have to
Right.
trust that eventually it will because we know that with brain science it eventually will.
Yeah. And I think that's the thing. We do know with brain science. And, Camila, I was thinking about for the folks that are here and asking great questions, like here's a great question from Chronic Superhero. A psychiatrist told me FND is psychiatric. I do not believe that, however, would like to ask you, the expert, what the ultimate answer is. And it is no longer understood as a purely psychiatric disorder. But that's what I learned in school. But that was 25 years ago. And our brain science, since you brought up the brain science, it's really caught up to understand it's much more multifactorial. So I know when we're talking about flares, we're talking about this kind of fear symptom cycle. It doesn't mean that all of your symptoms are psychiatrics. It's more that these other pieces, and this is true of every neurologic disorder, adding in the fear or avoidance or not even not even being able to sit with the symptom, for example, all of those things actually worsen the symptom. It doesn't mean it's a psychiatric symptom. It's just what we're talking about is how to kind of undo that cycle that makes it worse. So I just wanted to thank you for that question that was submitted. And I think it kind of brings up, I want to say it's nuanced, right? So many times I hop in here for a conversation, I'm like, these things are really nuanced. It's not a black and white, yes, it's psychiatric or no, it's not. It's like, well, actually, all of these things live in the brain and all of these areas in the brain talk to each other. So I wanted to people asked some really great questions. I think we talked a little bit. Somebody said how to make them not last as long, and you gave some really great suggestions for that cycle. But the second part of their question was not hate your life during them.
Yeah. Yeah. Um I really want to bring some connection and empathy to that. Let me tell you, when I had the stomach flu last week, I was hating my life.
Yeah.
Hating I did not want to feel that way. I did not want to be tremoring. I was really angry about it. I had to cancel all my clients, cancel all my plans to train, and I get really angry when I have to put other people in a position that's inconvenient for them. It makes me really upset, right? So you can hate your life, sure, for however long you need to hate your life, but then you also have a choice, right? Do how long do I want to perpetuate this feeling, this state of emotion? Is there anything that I can do to make myself a little bit more comfortable?
Mm-hmm.
Nobody wants to be throwing up. Nobody wants to be tremoring, but I am not going to hate my body for trying to protect me, right? I'm gonna thank my body for expelling whatever it needed to expel. And then I'm gonna soothe myself while I'm tremoring because I know that that my nervous system is just really dysregulated because like I don't like the state that I'm in and I need some extra self-care, and that's the communication that it's sending to me. So I'm going to honor that
Mhm.
communication, right? And then I threw on a movie, right? Like I allowed my cats to come and like snuggle with me. They were being so sweet, and so I started to shift my attention to what felt joyful,
Mm,
what felt calming. I don't know if any of you guys watched K-pop Demon Hunters, but
I love it.
like I threw on that movie and I was I'm gonna try to sing. While I'm like sitting there like tremoring, I was like, I'm gonna try to sing to this song.
Oh my
Like,
gosh.
just bring an element of what I know would make me just a little bit more joyful about what was happening. And then
Yeah.
eventually, eventually that's like what pathway my brain was following, and I felt so much better emotionally and more accepting of what was happening because I took the time to get in touch with what was going to make me more comfortable.
Yeah, gosh, I love, and you know what? This is, as a person that has always really struggled with even feeling I deserved self-care and soothing, the words that you're saying is like, wow, there can be barriers to going, I'm going to do like something that I know is good for myself, right? And I love how you leaned into that, and it also reminded me of in FND, there's this like higher activation of some of the attentional networks, the default mode network that are very internally fixated on symptoms and things happening in your body. And when you engage other things like watching K-pop Demon Hunters, like you actually start activating the salience network, which balances out the default mode network, and that literally loosens symptoms, right? It literally starts to turn them down.
Yeah.
And that is just taking advantage again of that brain science in a way to to get through that flare, through those moments of symptoms.
Wow. I love how you just brain science the fact that I decided to watch a movie, but
I know. I
you
can't help but imagine as you were talking, literally in my brain, like I'm like imagining different parts of the brain going like pew pew pew, like pew pew pew, like turning on and off. But so that was a really I think helpful response to a common question. And then this person asked too, what do you do when you know you need to rest or you'll flare, right? So I love that this person already knows this, but that voice in the back of your head is insisting that you can't stop working. This person went on to say, like, this is, can you tell I'm a workaholic or a recovering workaholic? What do you do in those cases?
Yeah. Yeah. Um, Gosh, this is such a fine line between do I push myself to expose myself to something that's going to make me a little bit anxious and push that boundary while I'm
Mm.
experiencing a symptom so that I can practice not being in that symptom fear cycle, right?
Hmm.
Versus, oh, I really need to rest and I need to honor what my body's saying because I know intuitively that's what's good for me, right? And
Mm.
this is a fine line that I come across with so many clients and with myself too, because sometimes I'm like, okay, if I'm in like active recovery from FND and I can feel a symptom bubbling up because there's something I'm uncomfortable about and it wants to protect me in that moment, then I'm gonna be like, okay, FND, like I see you, I know you're trying to protect me, but I actually like I got this, and I'm gonna
Mm.
say, and I can handle this, and like I don't need to have a symptom right now to protect me because FND is protective, right? But if it's more so like, oh, I can look back at my week, I know I've worked 4 long days for over 8 hours, and if I work that same way on the fifth day, I'm gonna be in a flare. that's like not wise, right?
Right.
So for me, it's always about gathering data points and
Hmm.
understanding like, is this kind of a valid situation where I should be resting? And usually the answer is yes. Usually 90% of the time the answer is yes, go rest. But if it's more so like, oh, this is a pattern symptom that shows up when I'm doing this specific thing because I'm nervous or because I'm being protected from grief or like my symptoms are trying to distract me from something else, then I'm like, okay, I need to expose myself
Mm.
and maybe tolerate the symptom while I'm doing that, right?
Yeah.
So
Yeah.
so there's like two ways that I would answer that question.
Yeah, I think that's great. Yeah. And I want to like really emphasize this isn't there's no one size fits all for anybody. As one person, I think this is maybe Krista Marie said, I've noticed I often have a surge forward in progress after a flare. So when I'm in it, I tell myself it's okay. My brain's just tuckered out after building all those new pathways. And I thought this was like a really beautiful way that also, and you had mentioned too, Kamila, a flare is information. You are actually getting some really good feedback about, like, okay, that was too much, or okay, I need more to soothe myself when I have like a stomach bug. Like I need maybe more than the average person, more electrolytes. I need more ice on my neck, or whatever those things are. And that's what you know and understand. And I love how Chris Marie said, like, maybe after that, I've learned something and then I'm actually making more progress. And
Wow.
that's another way to flip the script on the flare too.
Yeah. What incredible
Yeah.
insight.
I know.
Yeah.
I know. I'm telling you, the people in our community of reactive are brilliant. They're really, really brilliant. Um, and there's another person who is saying, I had a tumor in my left frontal lobe and there was not a pause anymore for a while. And I think this is when we were talking about kind of that cycle and pausing
Yeah.
before we're stuck in a place. And I think this is another really good point. I don't know if this is the case for freestyle kettlebell. But FND might actually also occur after a neurological disorder alongside it. And that's because some of those neural pathways got disrupted and the brain starts to learn new ways. And we can we can still intervene and recovery is really quite possible. Now, another question came in, and I think we could kind of almost like insert a blank. Do blank, blank, blank cause flare ups, right? So this person asked, do vaccines cause flare ups? But I would say, does the rain cause flare ups? Does getting an infection cause flare ups? Does a change in the atmospheric pressure cause flare ups? I mean, literally, we could go on and on for a million things that I have seen somebody flare from. And I want to ask you this question, but I am going to make one note about the vaccines because we do work with a lot of people with mast cell activation syndrome or MCAS. And folks who have a very overactive immune response that sometimes occurs with vaccines, that can trigger an FND flare. It doesn't mean don't get a vaccine. It might mean for many people, they need to actually really care and regulate their nervous system more. They might even be taking medication alongside of that if they're controlling another medical condition in order to do what they need to do in order to get vaccines if that's what they're doing. But how do you answer that question? Does X cause flare-ups?
Yeah. Yeah. I'm so happy that you asked this question. Whoever it was that asked this question. Um, it's such a great question, and I think a lot of people get stuck on pinpointing that one thing as like the
Mhm,
cause for all of their symptoms when it triggered FND, um, but it's not what's perpetuating FND,
mhm,
right? So there's factors that can predispose you to developing FND. There's like the catalyst that triggers the FND, kind of like pushes your nervous system over the edge, and whether that was a vaccine or whether that was the rain or whatever it was. Um, and then there's the way that you're approaching FND, which is what perpetuates the symptoms, right? Or maybe the factors in your life that are continuing to push your nervous system over the edge that perpetuate
Mm,
symptoms, right? So, uh, I would say like yes, a vaccine could be that catalyst. Yes, the rain could be that catalyst. In my personal experience, I had FND symptoms first after a vaccine. And then I had FND symptoms massively flare up after a surgery. So I was like, I've had two types of like Western medical interventions, and I probably have. I've never been diagnosed with MCAS, but I probably have some sort of like MCAS-y something going on in my system, because I know I have had these immune flares in the past.
mm,
Mind you, also, these two things happened when I was going through an incredibly stressful time in my life when
mm.
my brother was diagnosed with and battling brain cancer, and I was dealing with so much grief. But I did not put two and two together at that time that, like, those catalysts my body would react different to when I was under that much stress and pressure
Right.
because my nervous system was not regulated.
You were already overflowing at
Ex-
that point. Like,
Exactly.
yeah. And this level of inflammation, I know people ask me a lot about inflammation, and we know grief causes neuroinflammation. We know a virus might cause neuroinflammation, right? And there's not clear evidence or a biomarker that FND is caused by neuroinflammation, but we do know that inflammation generally causes some dysregulation in the nervous system. And so, if we're trying to look at all of those pieces together, and maybe those are what tip over your flare bucket, so to speak, then it's not just like, well, I don't encounter any piece of environmental anything. It's actually just looking at all of those pieces together, including how we are feeling. I mean, I think I was just thinking about this week because it's the anniversary of my mom dying. And I got like a cold earlier this week. And on that anniversary day, I felt like hell, right? And I was really aware of how much this grief was contributing to a very strong body symptom, right? It's not that my cold was due to grief, it's just the grief made it worse. I felt worse. Um,
Yes.
and yeah, so anyway, that's just zooming out to the whole picture, which is kind of what I want to say for this other question here in the chat. How can I stop doing Botox to do this work to heal instead? And so first I want to say none of this is personal medical advice. You should be working alongside your therapy team, your physicians. A lot of the people that I see that are doing Botox is because they have cervical dystonia. And in cervical dystonia, Botox is really, really effective. And what I see is as a physical therapist, I work alongside their physician. And if they want to come off the Botox, the physician and I work on, okay, well, what if we titrate this down? And what if we change this? And kind of slowly bring people down. And they're working on their recovery while they're doing that. I think people can, I don't know if that's the case for this person, but I think you can work alongside medical interventions and really do this healing work.
I think that's a great opportunity to say like these medical interventions can work so well when your nervous system is regulated,
Oh,
right? So
yes.
like going back to even like the vaccine or the surgery, 2 years later when my nervous system was regulated, I got another similar surgery, orthopedic surgery, no flare, no symptoms, right? Like, well,
Oh,
I had to recover from the surgery, like those symptoms existed, but no
yeah.
FND symptoms, right? So like
Mm,
then circling back to the Botox, like if you if you feel good about the Botox, if it's helping you, if you view it as like a safe intervention, if you're conceptualizing it in your nervous system as something that's good for you, it's going to help you.
Mm.
It's going to help you so much more than if you are like questioning whether it's going to help, or if it's like going to be the end all cure all that fixes all your symptoms and you're putting so much stock into that, right? Like then your nervous system is going to be dysregulated. But
Mm.
if you're like, this is just good for me and I'm going to do it and see if it helps and good things are coming, then that's going to regulate your nervous system and it's going to help you.
Yeah. Wow. That's really profound, Camille. I'm just like processing all of that. I love you so much. I feel so lucky to work alongside of you. Okay, another question that somebody submitted ahead of time, and this is from a clinician: how to prepare our patients for flares?
Ooh, okay, yes, good. Um, so many different ways. I think like one of the amazing things that the OTs do here at Reactive is these like flare plans, and sensory ladders and like seizure plans, right? This is exactly and you work directly with the patient, and the amazing OTs here like are creating these plans together with the patient, right? So looking at like what are your specific sensory needs? If I was flaring, like, do I want a weighted blanket? Do I want ice on my neck? Do I want some electrolytes? Do I want
Mm.
somebody to speak to me? Do I want to be alone? Do I want to put K-pop Demon Hunters on? Do I want my cat? Do like what is it that's in my toolkit that's gonna regulate me that I know is gonna be soothing regardless of whether I'm
Mhm.
or not, and just like have that on my hit list of resources to go to. Um, and that's great preparation because then you're less afraid of when it happens
Yeah.
because you immediately have just like a toolkit to reference. And if you can't remember when you're dysregulated, you have it on a piece of paper that you can just go to, right? What I love about some of these plans too is they give instructions for whoever else is around, right? Like
Yeah.
if somebody's in the middle of an FND seizure, then like don't call 911, put me in a comfortable position, right? Like just give me some space and wait, right? Like cuz maybe I can hear you and maybe like maybe I don't want you to freak out. Just, wait for me to wake up and
Mhm.
or squeeze my hand or whatever.
Beautiful.
So there's like there's so many different ways to prepare somebody for a flare, but I think like being collaborative with it is really important. And I would say that the sensory resources, the sensory toolkit is probably like the most important thing for just down regulating the nervous system.
Yeah, yeah, that's great. Now, a couple of we had really good questions, and I see some coming in here, but I want to get to the ones that were submitted ahead. This one, I know I shared with you these ahead of time, but this was from a person who really feels depressed and is crying because they're living with FND. And what are suggestions for that?
Yeah. Oh, it's like so normal and natural to feel depressed and cry and scared. Um, Gosh, I can remember so many nights and like a few in particular that if I go back into my memory, just feeling so distraught and crying for hours because I was like, I don't know what this is. At
Mm.
one point I thought I was like possessed because my body was moving around in different ways. And when you're in that headspace, you feel completely distraught, right?
Mm.
So I can resonate with that, and I bring a lot of love and connection to that, and um, like the biggest thing I can say is that there is hope, and we know through a lot of really cutting edge brain science that it's it's a very treatable condition, and it's multifaceted, and there are lots of ways to heal. Like one of my supervisors in my private practice loves to say there are many paths to regulation. So
Hmm.
it's not like there's a one size fits all. There's so many different things for you to try that might work. And that's actually such a good thing. Like it's such an empowering thing. Because there's all these different ways and you're not alone, right? Like you're not
Yeah.
alone. There are communities out there to support you. I am so sure that there are people that love you in your inner circle that want to see you happy, and you definitely don't have to shoulder this by yourself. And I think where a lot of people get caught in flares or in feeling like they don't have anyone is like when they isolate themselves, right?
Hmm.
So biggest thing if you're feeling like sad or depressed, please don't isolate yourself. Like reach out.
Yeah. Yeah. Such a strong message. I think sometimes in at least our like Western culture, it's like you could do it by yourself. And like I just firmly believe in the power of community. I know you feel that way too, Kamila. This is less related to flares, but I kind of want to bring it into flares. But somebody asked, can you talk about breathing issues in FND? It often feels hard to breathe, but it tests fine. And maybe I'll be brief here because sometimes breathing can be so regulating to the nervous system, but it also can be very internally focused. And the more you think about it, the worse it gets. And while breathing has been kind of advocated as this like very relaxing activity, oftentimes folks with FND find it the opposite because of the internal focus and might need other ways to breathe and regulate. But I wonder if you had any thoughts with the breathing question also, Kamila.
Yeah. I mean, this is one of the symptoms that I experienced was like a shortness of breath randomly.
Mm-hmm.
Uh, and yeah, totally FND related, right? Because it tests normal. I like remember going to my lung specialist and being like, "Do I have asthma again?" Because I grew up with
Mm-hmm.
do I have childhood? I grew up with childhood asthma, and he was like, "No, you don't." And I was like, "Oh, this must be FND then." And I like and then just regulated myself, and I was like, "Fine." Um, but regardless, like breathing, yes, it's an internally focused thing, and for some people, it can be really dysregulating because of that. So that intervention is definitely not for everyone
Mm-hmm.
um, because it can bring in that internal focus. And there are specific ways to do it that might feel more regulating than others. But what I like to tell people is like whenever they ask about a specific symptom, I just tell them like if your nervous system was an umbrella and there's all these raindrops coming out of this umbrella, right? Like all your symptoms fit under that or a cloud or something that raindrops are falling out of and each symptom is a raindrop. That cloud is your nervous system, and when you regulate the cloud, all of those symptoms start to like fall away because they're all the same thing. They're all coming from the same place, like the limbic system in the brain, right? So it doesn't matter whether it's like sensory breathing issue or a sensory swallowing issue or there's pain in my feet issue or numbness and tingling or tremoring. Like if you practice the nervous system regulation, it doesn't matter which new symptom is going to pop up. It's all actually the same, which is like a really empowering thing, right?
Yeah.
Um,
Yeah.
you don't have to be afraid of something new popping up because it's the same.
Yeah. Yeah. Now, I want to get to some of the questions here. I know we'll just take a few more minutes because my family's like, "Are you coming to dinner?" What do you do? So Eugene is asking, what do you do when a flare becomes your new baseline? Does the approach change when symptoms turn long term?
Sorry, can you ask that again? I wasn't sure I quite followed it.
Yeah, I think, well, and it's kind of a two-part question in a way, but it's like if you have a flare and you're kind of worse in that flare and it never gets better. So that becomes your new baseline,
Oh, I
right? So your symptoms maybe have progressed and this is your new baseline. Um, is there a difference in your approach at that point?
Yes and no, right? Like when I was talking about the umbrella and like continuing to regulate the nervous system, you just want to think of it as like, okay, I've, I'm having an increase in symptoms, but that doesn't mean I should be any more afraid of them. It's just more information, more data points. Like, look at the stressors in my life, look at what could have potentially put me here, and kind of like understand my triggers. And at the same time, you don't want to do anything that puts you in danger, right? So
Mhm.
I think I would reassess like, okay, if this is my new baseline, is there anything I need to adapt to? Like, for example, do I need to use a walker for like a week um,
Mhm.
in order to just re-regulate myself and reestablish my safety while walking, and then resume once I'm feeling more stronger and more automatic, right?
Mhm.
but but that doesn't necessarily mean I need to like completely stop what I'm doing, or like you still always want to be in recovery, kind of like pushing that boundary of what you're capable of in order to explore what your nervous system can handle, and without making yourself unsafe, right? So
Yeah.
I think that's how I would approach it, but I wouldn't be afraid of an increase in symptoms if that happens. Like the acceptance around that is really important, because the more you accept that something is happening, the less your nervous system deems it as a threat.
Right, right. Which just helps that whole cycle again. I know in our team, that theme of acceptance, acceptance doesn't mean you're resigned to this is how it's going to be forever. It's just being with it versus like, I'm running away, which automatically, even as I say, like I swear my heart rate goes up, like my pupils are bigger, like everything changes in my nervous system, right? So that acceptance is is probably the hardest and it's also such like a necessary step of the
Yeah.
process.
Acceptance does not equal agreement.
Mm-mm.
You don't even have to like it.
No.
You just it's sitting there on your shoulder. It just wants to be along for the ride, and you're like, okay, fine.
Yeah, yeah. Now, a very specific question here from Lizzie that I think is really interesting and shows the overlap of FND with other things. Lizzie says, I got injured in 2022, got diagnosed with AMPS, amplified musculoskeletal pain syndrome, and then a little bit later got diagnosed with FND. Do you guys know anything about AMPS and how it is different? So I have to say, Lizzie, this is something that we see commonly alongside FND. And if you've read about AMPS at all, I don't know how familiar you are with AMPS, also, Kamila, but essentially, this amplified musculoskeletal pain syndrome is a functional pain syndrome, right? So it is your brain has developed this amplification of pain. And there are many, by the way, other pain syndromes that you could put under the umbrella of functional neurologic disorders because it is a network dysfunction in the brain. And that is what's underlying AMPS as well. And so it's not surprising that we might see them together. And a lot of these things that you've been sharing, Kamila, are helpful for many pain syndromes, right? Um, not just AMPS.
Yeah, yeah.
Yeah.
I've actually never heard of that term, but as soon as you uh, told me what it stands for, I'm like, oh, that sounds like FND.
Yeah. It sounds a lot like FND. I think what sets it apart is that it's pain.
Right.
So when I think about outputs of the nervous system, right? Pain is an output. It's something that the nervous system outputs. it's also an input, but that's like a little bit neuro nerdy. We won't go there yet. But in FND, tremor might have been that output, or dystonia or weakness. It's what the brain has produced in response to whatever is happening in the brain and body, right? So I think of them as in parallel lines, right? So typically when somebody has a pain syndrome and FND, it's like, well, they have pain and maybe it's AMPS, maybe it's CRPS. Those are probably the two most common that we see. And they have developed weakness, they've developed tremor, maybe they've developed sensory loss, and those things are the FND. So that's how I would also separate them. But I also would say, treatment wise, we're like, you're all one person, right? You're not a diagnosis. You are a person, and you're a person with all of the things. And the treatment is complementary for all of it. Chronic Superhero is saying, love this live. I'm so glad you're here. And then oh, back to the dystonia question. So I did want to really relate here. Can I recover from dystonia without Botox? There are many types of dystonia, and many people get better without Botox. So I kind of want to state that clearly. Idiopathic cervical dystonia does really well with Botox, but there's also functional dystonia, which absolutely should not be treated with Botox. And it would be important to go to a movement disorder neurologist to differentiate which is which. There's also genetic dystonias. These are not functional dystonias. So all dystonias are not functional dystonia. People might actually have both. So they might have a genetic dystonia and develop a functional neurologic disorder with it. And it would be really important to get that distinction with a movement disorder neurologist. Another comment here, Mayo Clinic doctors have documented that I got FND as a result of a vaccine. My neurologist, internal medicine doctor, and doctor of rehab all wrote it. Yeah, so that might have been, I love how you kind of had this catalyst idea. And what we typically see in FND is kind of a constellation of things, whether that's events or various predisposing genetic immune factors for a person, and potentially a catalyst. But sometimes we see nothing, like there was no event, right? And so there's not one way to develop FND. Another really helpful comment. I have MCAS and I have to plan a week to be moderately sick after a vaccine, but it's still better than getting the actual sickness. Like, yes, for many people. And the thing is, you plan and you just know that. Many people with MCAS over time, they learn those things and they just know it, and then they know what to do, and that lowers the nervous system activation, right? Chronic Superhero is saying the body is all connected, brain and all. Yeah, and then another comment, I just want to be able to heal this naturally. And this is what I want to tell you in regards to dystonia. We see many people with dystonia get better with and without Botox. There's not one way there. And many people want to be able to do things without medications. There's a time and place for all of those things. And Krista Marie is saying it's helpful to hear my FND manifests as cervical dystonia. I haven't tried Botox, and I've made tons of progress with physical therapy. It's also really helpful to hear from other people that they get better, right? Like, I think this is such an amazing part of hearing your story, Kamila, is you had symptoms for 2 years. And when you listed those symptoms, Kamila, they went on and on and on.
Oh yeah. Yeah, they did not stop and they kept changing too. And I was like, do I have every disease possible?
Right,
It,
right.
but that's like the amazing thing about the brain is how much it can fabricate and how variable it can be. It's like, it's incredible what our brains can do to try to protect us.
Yeah. Somebody else, Eugene, thanks for being here. Eugene submitted great questions, is just saying thank you and for answering. Somebody else is asking, is full body numbness all over for years, FND 24/7? And this is where I have to tell you, I don't know. Um, Full body numbness, have I seen people with FND with full body numbness? Absolutely. Are there other neurologic disorders that can cause that? Yes. Um, and what is helpful for every person is to have a positive diagnosis. Full body numbness due to FND actually looks different than full body numbness due to a high level cervical spinal cord injury, for example. And a neurologist has tests and measures that they can do clinically with a person to show that numbness could be due to FND. And so that's what I recommend, is really having a neurologist explain and go through clinical testing. No, there's not imaging that proves FND. It's a clinical diagnosis, much like many other neurologic diagnoses. Parkinson's, for example. These are clinical diagnoses made from clinical exams. Really, really great question. I think we made it through all of them.
You like
And
you speeded through.
I was like, there's so many, so many. Oh, you know what? I missed this one. I think this was back to the breathing question. Thank you for talking on this. It's different than a panic attack. It is like often having to remember to breathe or feeling as I can't breathe because of the overregulation.
Yeah.
That's a good explanation there, I think,
Yeah.
from that person.
Yeah.
Um,
I think
yeah.
if that person has been diagnosed with FND and like other clinical things ruled out, that I mean, it's probably like a fixation on that automatic breathing process, right? And that internal focus. And so you feel like you have to breathe, or you're like, oh, why didn't I breathe during that moment? And you become hyperfixated, right? And then the nervous system jacks up because you feel anxious about it. So it like all of those symptoms make sense within the context of FND.
Yeah, they really do. And I want to end here maybe with Lizzie's comment about amps and often not having it's like a delayed response for her. And she's also commenting, I'm very hypermobile. And so, Lizzie, this is something that Kamila and I see in practice very often. It's been shown in the research that FND can come right alongside hypermobility. They are not the same thing, but it makes sense that a person with hypermobility might develop FND or AMPS because they're actually not getting great feedback from the body because of the hypermobility. Proprioceptive feedback might be off, sensory feedback might be off, interoceptive or internal feedback from the body might not be as accurate. And then your brain goes wild with predictions, like it relies more heavily on predictions because of that. And that is where therapy comes in. We can help figure those things out, support the brain and body, and update those predictions. And I have a lot of hope for you, is what I wanted to say. And Krista Marie, I think, is saying this has been so helpful. Thank you so much. I'm 2 years in, and it's inspiring hearing from others who have made so much progress. Yeah, it
Yeah.
is.
I'm glad it was helpful for you, Krista. Yeah.
Yeah. And so many people. Kamila, this was so helpful for me. I'm going to put this recording on repeat. Some of the things that you said were just so helpful. I hope we had a lot of clinicians watching, because I think the way you approach your care, the way you talk about these things, it's with such understanding and validation, as well as just like helpful reframes that yeah, it's just like pure healing. And I'm just so thankful, Camila. Thank you so much. um
For your empathy plus amazing brain sciencey brain.
And maybe you could tell people what's coming up next, like professional volleyball wise. Where should we be finding you and watching you?
Yeah, I actually, oh man, I had like a little bit of a lot of activation today because the tournament that I'm supposed to be playing in December, the USA Volleyball country quoted the tournament, which means that they dramatically reduced the amount of US teams that can be in it.
Oh,
So I might have gotten kicked out.
no.
Well, I'm like so bummed today. Can you tell that
Yeah.
big smile on my face? No. But yeah, it's the next one is supposed to be early December, that first week of December 4th through 12th. That's
Okay.
supposed to be competing. Uh, but TBD, I'll leave you on your toes
Okay. You'll leave us on our toes. Uh,
anymore.
yeah. Yeah. Well, I love watching you play. So, thank you. Thank you for everything, and for answering so many great questions. And we'll talk again soon.
Yeah, thank you.
Thank you.
Thanks everyone for participating.
Bye.